When seizures start focal, like a twitching hand, and then they spread to the whole body, always think structural brain lesion. This kind of bilateral tonic-clonic seizure implies a local origin, often from trauma, tumor, or a scarred area of cortex. These post-ictal symptoms like your weakness, it's known as Todd's paralysis, further points to focal process. Don't be distracted by some, metabolic causes. They usually trigger your generalized seizure. The key here is that it starts locally and then leads to lateralized defects. And that should scream one word for you: structural cause. So we start with the right hand twitching, we go to focal to bilateral tonic-clonic, and we have this Todd's paralysis confirms our focal origin after the fact. Most common cause is structural brain lesions, trauma, stroke, and a history of concussions, post-traumatic gliosis or scarring. So here's our question. 38-year-old man, repeated focal seizures beginning in his left arm, and then it evolves to tonic-clonic, and he has mild left arm weakness after the events. What's the most likely cause? Okay, so take a look at these answers, try to answer. The answer is boom, 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 structural brain lesion. So you got that focal onset, you got that post-ictal weakness, the local neuronal hyperexcitability due to the focal damage, the trauma. All right, JME, that's going to be in adolescence with your jerks and often bilateral and generalized. Structural brain lesion, bingo, alcohol withdrawal causes generalized tonic-clonic, not going to be your focal signs, it's just general. Electrolyte imbalances, this would be like your sodium, calcium, glucose. This would be generalized seizure patterns. And childhood epilepsy syndrome, this is going to be onset typically before the age 18, excuse me. This is a 38-year-old dude, so not going to be that. Also tonic-clonic, some of you guys might be like, what is a tonic-clonic? That's formerly called your grand mal, and it's going to be your generalized seizure with two distinct phases. You have a key phase, this is the tonic phase. It's going to be 10 to 20 seconds of muscle stiffening. Think like Neville Longbottom in Harry Potter. He just muscle stiffens. You might have a crying sound due to the air that's forced out of your lungs. Loss of consciousness as well. Patients can fall rigidly. Think of that episode of House where she gets like this tonic phase of a seizure. Clonic then is the clonic phase is 30 to 60 seconds. It's rhythmic jerking of the limbs and the face. Alternating contraction, relaxing, contraction, relaxing. Bite your tongue. Incontinence, right? That's what happens in the clonic phase. The post-ictal phase is minutes to hours afterwards. You have some confusion. Todd's paralysis is what we talked about, temporary weakness. This post-ictal phase is minutes to hours afterwards. And so, yeah, you'll a tonic-clonic seizure starts with the tonic stiffening and then clonic jerking, and then you're out of control. And so you collapse, you convulse, and you have a very confused recovery. So yeah, that's kind of the lingo here, the lay of the land. Hopefully this is helpful. Check it out. Subscribe. Yeah, man, look at that. I'm like right there by the button. You can just see it. Actually, the subscribe button's like down here. But yeah, if you like this stuff, then sub.